Untold Physio Stories is part of the all-new PT Podcast Network. Find a new favorite podcast by an amazing PT content creator at ptpodcastnetwork.com. The future of medical documentation is here, and it's revolutionizing the way we record patient visits. Introducing Comprehend PT, the groundbreaking HIPAA-compliant AI scribe designed specifically for physical therapists. Imagine a world where the dialogue between PTs and patients is interpreted by AI into precise, real-time medical notes without lifting a pen or tapping a keyboard. Comprehend PT does just that, allowing healthcare professionals to stay engaged with patients rather than buried in documentation. Boost your efficiency, reduce claim denials, and liberate yourself from the burdens of manual note-taking with Comprehend PT. Join the revolution now at comprehendpt.com. Untold Physio Stories listeners get 50% off their first month with code MMT50, and there's a free trial available. Sign up now. I use it every day in the clinic for virtual and live visits. I just speak to the patient and at the end hit Comprehend and a SOAP note's generated. I love it and you will too. Welcome to Untold Physio Stories podcast, your perfect commute resource with physio failures, successes, interesting cases, and more from the physio and rehab world with your hosts, Drs. Andrew Rothschild and Urson Religioso. Welcome back to Untold Physio Stories podcast. I'm one of your hosts, Dr. E with Modern Manual Therapy, Edge Mobility System, and our 4-month online mentoring program, Modern Rehab Mastery. And I'm back finally with my co-host,
Andrew Rothschild.
Yeah. How's it going, Andrew?
It's going good, Urson. How are you?
Good. Andrew has a story today, even though it's not one of his, but he has something to share. What's going on?
Yeah, it seems lately like all my colleagues are getting interesting cases, so I'm going to have to piggyback off of them. So I'll relay it the best I can with the information that I have. So one of my colleagues had a new eval earlier this week, and it was a woman. I think she was in her sort of like late 50s. Early 60s, she presented with sort of left-sided, primarily abdominal pain, but it kind of wrapped around that, sort of lower thoracic region. No mechanism of injury. She's a pretty active person. She walks, she does resistance training, that kind of stuff, but no mechanism, no incident. She recalled having a similar episode of symptoms like this earlier in the year, like around May, I think he said. Again, with that situation, there was no sort of specific mechanism, and it kind of, I think, just resolved on its own without any specific treatment. The referral from the physician, of course, was abdominal strain, which, again, is, sort of laughable. And he said during the exam, he really could not reproduce those symptoms. She had a little bit of, like, sort of low back pain with like extension, but it was like, just kind of like that pinchy low back pain. That's not really pain. It's like that is a normal kind of sensation and was really not her symptoms. Side bending, rotation, resistance testing, nothing really reproduced her symptoms. And, with palpation, he felt, he kind of felt just a few centimeters lateral to the umbilicus. He kind of felt a little bit of that sort of pulsatile thing. That was sort of unusual. I think it was a little bit sensitive, a little bit tender. And so he was concerned with an abdominal aortic.
You mean he felt a pulse?
He felt like a pulsatile, kind of felt some pulsing, throbbing kind of sensation. And so he was concerned about a potential abdominal aortic aneurysm. And he ended up recommending that she go to the ER, and that was the sort of the end of the, that was what he was telling me about the consult. And then she, I guess, had left a message that evening that she had gone to the ER, and it was, something that had to be taken care of, but it wasn't like emergent. So I guess, we were really still weren't sure what it was until the following day. He was able to get in touch with her. Do you have any guesses of what it could be, or what like differential diagnosis on your thought process?
Pulsatile. And on the left side of the umbilicus?
Yeah.
So wait, you're saying you have an answer though, right? Because
Well, yeah,
obviously I'm treating this as a puzzle and I'm thinking like, oh,
yeah,
it's this. When you said left-sided, thoracic, I was trying to remember whether you said left or right, and if it was
yeah.
right, I would have said, oh, it's a gallbladder referral.
It is.
But
It was left-sided.
yeah, I know. So it was left-sided, so I'm like, it's not gallbladder referral because gallbladder is right, correct? Correct, like
Correct.
right
Yes.
TL, yeah. Left. I mean, I would think it's some sort of like aortic something.
Yeah.
I don't know.
I'm glad he's a new. I should say he's also a new grad therapist, so he's only been out for like 6 months.
They tend
Um,
to know. I feel like their differentials a bit better than we do, though.
yeah, and it sounds like they had some good grilling in those topics. But thankfully, it was not that. It turned out to be something way more benign. It was severe constipation.
Oh, okay.
Yeah,
I,
and and it kind of makes
that's
sense.
something that we don't really ask about, though, right?
Exactly. I was like, oh yeah, okay. Which was, again, it makes sense because that can refer to the abdominal area. Obviously, it could also refer to like the back sometimes. And the fact that it happened a few months earlier, I guess, if you consider that it could have been
Oh, right. It also
aneurysm.
happened a few months earlier. Yeah.
I mean, it still could have been an aneurysm that was not so severe that was like about to burst, but was just
Right.
enough to cause symptoms and then settle down.
Yeah. I mean, maybe they were doing like Valsalvas or something.
Yeah,
At the time. Yeah. Yeah.
but the fact, and I was very proud that he, told him that, the whole point of that's one of the main purposes of a thorough exam is really to rule out serious pathology and make sure that what we're seeing is a musculoskeletal, especially with the referral of abdominal strain when there was absolutely zero mechanism that would make sense for that.
Right.
When you can't
Everything's a strain. I know. You know what I mean? Like, how many times
avoid
have you
strain.
ever seen a low back strain? Like so many times you prescribe low back strain. Meanwhile, they have like a radiculopathy or something and a foot
Right.
drop, and it's like, is this really a strain? Like, how many times have you strained an erector?
Right. It's like I've never in my life seen a rhomboid strain. Like maybe if
Right.
somebody dove and grabbed somebody from falling out of a helicopter, maybe you could do a little rhomboid strain. But it's not, outside of that. It's not something that really occurs.
Oh man, I just watched the last episode of Reacher. Did you?
Phenomenal.
You know what though? I feel because you said that, I was like, there's no way he didn't just watch that. I don't know. Not to get off the topic, because I know that in my old podcast, Gene and I used to talk about Star Wars all the time, but I kind of feel like they jumped the shark a little bit. I mean, like, how many times can you catch someone falling out of a helicopter? He's not Steve Rogers, even though he actually looks like he's stronger than Captain America.
Everybody who's going to listen to this and hasn't seen the finale yet.
I know. I'm sorry. Maybe I'll publish this one in another 2 or 3 weeks. But yeah,
it was a little bit. I'll give him a little bit benefit of like the willing suspension of disbelief. But yes, it was a little bit more so than in the previous season.
But also, she climbed out. She was stabbed in the arm, and then she's with a stabbed arm. She unbuckled herself and then climbed up the thing.
It's called adrenaline, Urson. These things happen.
I guess so. Yeah, adrenaline. You totally forget about that arm wound.
She's a badass. These things
happen. Right. But I mean, overall, it was a great season. And,
loved it.
But let me tell you what, Robert Patrick, he really let himself go. He doesn't look like he's a Terminator anymore.
I said the exact same thing to my wife because she was watching. I guess there's an old show that was on that he was also in that she's been watching old episodes, and it wasn't that long ago though. And I was like, wow, he really kind of lost himself there a bit.
Yeah, I know he did. I mean, he was a pretty good bad guy, though. I mean, he was a hateable bad guy for sure.
Oh yeah, he did great.
Yeah. All right.
Yeah.
Well,
constipation. Back to the topic. Constipation is just wild. Like that's kind of makes you think like sometimes there's. More questions we should ask.
I am thinking I should ask this because how many times?
Yeah.
I mean, we never ask this. We always ask about a loss,
right?
And then I remember my wife, back when she used to do women's health, she would say, you know what? I don't ask about a loss of bowel and bladder control. I ask about increased frequency and urgency, because like people always think that a loss is just like, they're like peeing and pooping themselves, or they have to wear
Right, right.
Depends as an adult or something. But she's like, even a frequency and urgency is a question that we should really be asking,
Yeah.
but not a lot, not like a no,
Right.
or you haven't been moving your bowels or anything. That's super
Yeah.
interesting.
Yeah.
Yeah. All right. Well, that is a great story. All right. Well, if you guys have any interesting cases or big physio failures, make sure to reach out to Andrew and get on the podcast. And welcome back, Untold Physio Stories. We've been taking a break. I took a break from the podcast for about 3 weeks for the holidays and everything, and then I was stranded in Idaho and whatever, so because of all the snow. So we're back and going to release regular episodes again. So make sure to rate us 5 stars and hit that subscribe button. And again, please leave us more, especially ratings on iTunes or Apple Podcasts and Spotify. And as always, you guys have a great day.